The U.S. says it is confident it can contain and eliminate monkeypox from its shores.
That's despite criticism. The Biden administration was caught off guard when the virus arrived some 2 months back. Washington is hopeful testing and vaccines will do the trick after the World Health Organization declared the spread of the outbreak a global health emergency.
The move has prompted governments to raise their alerts as more cases are reported. The WHO hopes the declaration will pool global efforts to battle the illness, which is spread through close physical contact. For more, Dr. Amesh Adalja joins us now. He is senior scholar from the Johns Hopkins University Center for Health Security, and he speaks to us from New York. Doctor, the WHO has declared this illness a global health emergency, but the committee of experts who met to discuss the virus were not able to reach a consensus. Does that tell us something? How concerned should we be if this panel couldn't come to a unanimous conclusion?
I think there's a lot of effort spent trying to understand when the WHO declares a public health emergency and when they don't. And the criteria has always been opaque to me. And I think this is an area where I think it could have went either way. And I think there's an argument to be made on either side. But regardless, even if the WHO didn't declare this, we knew what actions needed to be taken. We knew what this threat represented. And we knew that there had to be better coordination and attention to testing and getting the vaccine to those at risk.
And just to give us a better understanding, anyone can catch monkeypox, can't they? It's spread through skin-to-skin contact and droplets from sneezing, coughing, or kissing. What do you make of the notion that it's more prone in the LGBTQ plus community?
While it's true that anybody can get monkeypox, there are unique characteristics of this outbreak, meaning that it's found itself in a social and sexual network. And when you look at the epidemiology, the predominant individuals getting infected are men who have sex with other men. That's a clear epidemiological signal, and that tells us we need to increase testing in that population. We need to prioritize vaccine in that population because that's where it's spreading. There will be some spill outside of that demographic group, but the priority has to be protecting the people that are actually at risk. And it's not that contagious of an infection. It's not something that you get casually. It is skin-to-skin contact, close contact, and that's what's happening in those groups if you read the case studies of people, how they're getting infected.
The U.S. Centers for Disease Control has put in additional orders for vaccinations, but some reports indicate that those won't be available until next year, and demand for vaccinations in other countries outpacing the supply available. Is the supply crunch going to be the reason the world faces an uncontrollable outbreak here?
The supply of the vaccine is the rate-limiting step at controlling this outbreak, because we know that this vaccine is effective, that it's been used to stop monkeypox outbreaks in the past. It's just that there's not enough of this second-generation vaccine. And then we may need to think about innovative strategies, prioritizing first doses instead of doing the 2-dose regimen, and also thinking about older smallpox vaccines for those individuals who are able to receive them, because there's a different risk profile for the first-generation smallpox vaccines. But that's the key to stopping this, is getting vaccine into those who are at highest risk, those who have been exposed. That's how you stop monkeypox outbreaks.
And given it's an infectious disease, are there any other lessons that can be learned from COVID-19 in terms of how it can and should be handled?
Well, I think the biggest lesson, and you can't completely extrapolate everything from COVID-19, it's a very different type of virus, is that you have to be proactive. You have to put in place systems to be able to quickly test, to be able to contact trace, and you have to deploy vaccine effectively. What we've seen in the United States is incompetence. Our testing strategy was flawed, just as it was with COVID-19. Our vaccine distribution has been flawed. All of that is something that's worrisome because it's happening on the heels of the COVID-19 pandemic, and it doesn't give someone like me a lot of confidence that the United States has learned from the COVID-19 pandemic, and there is still a lot of work to do to increase our resiliency against infectious disease emergencies.
Doctor, a moment ago you mentioned transmission involves close contact. How else can we protect ourselves? What should people do if they experience any symptoms?
Well, monkeypox has a characteristic rash, and that's going to be a person's tell that they may have been exposed to monkeypox. But what you should do is think about your contacts, especially if you're a man who has sex with other men. You have to recognize that this virus is spreading rampantly in that population. And that sexual contact may be one way that this virus you get exposed to this virus. So those individuals should get vaccinated as soon as possible and be very careful with any kind of sexual or close contact, because that's how we're seeing transmission occur. The threat to the general public is low at this time, but if they are involved with somebody that might have been exposed to monkeypox or has monkeypox, they need to take care. This isn't something you get casually, and that's going to be one of the keys to controlling it, to prevent its spread outside of the social group that it's found itself in right now.
And do you see monkeypox being with us for the foreseeable future, given the response to it so far?
I think that we're going to see some time before cases are controlled outside of the endemic African countries. But this is not a disease that can be eradicated. It's always been present in Africa, in those half dozen or so countries where it's endemic. But I think what this argues for is that perhaps we should be vaccinating in Africa, vaccinating at the source of the outbreak, understanding which animal reservoir exists, and really concentrating on preventing animal to human exposures that are occurring in Africa. I've been talking about monkeypox probably for a decade or so in my field, but most people have not really thought of it as anything but a travel medicine oddity and not really addressed the actual issue, which is controlling this at the source in Africa by doing much broader vaccination campaigns there.